The Biology Club I Teach department presents National Diabetes Awareness Month. Diabetes is affecting more and more of us every day. Family members, friends, maybe even you. And many of us don't even know what diabetes is, or if we are at risk. So, raising awareness plays a major role in standing up against diabetes. And today, we have our Bio Club members to explain what diabetes actually is, how do people get it, its treatments and side effects, how people with diabetes are more likely to have serious complications from COVID, genetic inheritance of diabetes, and how we can raise awareness and fight against it. So, what is diabetes exactly? Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy, in which the body does not properly process food or use as energy. Not only that, but if you have diabetes, your glucose levels will continue to rise after you eat because there is not enough insulin to move the glucose into your body's cells. Diabetes is an epidemic, growing day by day. Every 7 seconds, one person dies of diabetes. Not only that, but also close to 1 billion people are affected with diabetes.
Well, some people ask, is diabetes contagious? And how can it pass from one person to another? Well, science has confirmed that diabetes is a non-communicable disease, so it's not contagious nor a diagnosis disease. Treatments for diabetes requires keeping close watch over your blood sugar levels with a combination of medications, exercise, and diet. By paying close attention to what and when you eat, you can avoid the seesaw effect of rapidly changing blood sugar levels, which can require quick changes in medication dosages, especially insulin. How certain food can aggravate on diabetes. When unhealthy saturated and trans fats can increase cholesterol levels in the blood, and high cholesterol is a risk factor for type 2 diabetes. Trans fats appear in packaged baked goods and fried foods in restaurants, while saturated fats can be found in fatty meals, butter, and full-fat milk and cheese. How does insulin work? Insulin is produced in the pancreatic islets, which are small isolated in special cells in the pancreas. Insulin works alongside glycan, another hormone produced by the pancreas, to manage the level of glucose in your blood. Both insulin and glycagen are secreted directly into your bloodstream and work together to regulate your blood glucose levels. Insulin should stop your blood sugar from rising too high, and glycagen should prevent it from becoming too low. Insulin is produced by the beta cells of the pancreatic islets. Insulin is released when you have just eaten a meal and the level of glucose in your bloodstream is high. It works by stimulating the uptake of glucose into cells, lowering your blood sugar level. Your liver and muscles can take up glucose either for immediate energy or to be stored as glucose until it's needed.
Hi, my name is Ezaz Zaidi and I am 52 years old. Just want to talk about the diabetic lifestyle, what we have and how we manage it. I just want to tell you that I was diagnosed with a type 2 diabetic, which most of the people in UAE are prone to, but maybe they are not aware of it because of the lifestyle which we have. And when I spoke to the doctors, they have said that this is a very common problem which people have and they are not aware of it. There is no problems I have with being a type 2 diabetic. However, I have learned to overcome this. What mainly the people or the doctors have told me is you should go for regular exercises daily and walk, make walks every day, go for swimming and be more physically active rather than being a potato couch and sitting and doing nothing, because that builds your into your cholesterol and then it leads to more diabetic and it impacts your pancreas, which stops developing your insulin. That's the major cause of which leads to the type 2 diabetes as a lazy lifestyle. So my humble request and plea to all of you and with my experience, is to have an active lifestyle, follow a routine, and stick to the routine. Do not break your routine just because you feel okay one day and you think you have overcome it. It's a way of life. It's not a temporary thing which you think you can do for a month or so, or diet and get away with it. And diabetes is not related to food. What I know, what I've heard, is it's more related to stress and lifestyle. So my piece of advice to all of you is to have a healthy and active life, and wish you all good luck, and we all can overcome it. If I can, and some of the people I know, they have overcome it, so everybody else can overcome it. That's it, and good luck, and take care of your health.
How the UAE stands up and fights against diabetes. 1 in 5 people in the UAE has diabetes, making it one of the most pressing healthcare challenges in the country. What's needed to turn the tables is raising awareness and research into the issue. The UAE Ministry of Health and Prevention launched a diabetes screening and professional healthcare education program aimed to provide better medical care to diabetic patients. The Diabetes Education Initiative will address critical areas of diabetes management such as maintaining a healthy lifestyle for diabetes prevention, increasing rate of diagnosis, early detection, and improved care with self-management programs. And new research has shown that the amount of serious illness caused by diabetes in the UAE has dropped compared with other diseases such as cancer. Does corona really affect diabetics severely? On the other hand, there is not enough data to show whether people with diabetes are more likely to get COVID-19 than the general population. The problem people with diabetes face is they're more likely to have worse complications if they get it, not a higher chance of getting the virus. In general, people with diabetes are more likely to have severe symptoms and complications when infected with any virus.
Diabetes, and what are the two main types? So, type 1 diabetes happens when the immune system attacks and destroys the cells of the pancreas that produces the insulin. People with type 1 diabetes need insulin to keep their blood sugars in a normal range. Type 2 is a little bit different though. A person with type 2 still produces insulin, but the body does not respond to it normally. So glucose isn't able to enter the cells and supply energy. What are some of the symptoms? So, for type 1, it's weight loss and urinating often. For type 2, it's tingling, pain, or numbness in the hands or feet. What are some of the short-term effects of diabetes? The most common short-term effect is blood glucose is too low or blood glucose is too high, also called hypoglycemia. The most common long-term diabetes-related problems are large blood vessels of the heart, brain, and legs, and some smaller blood vessels like the eyes, kidneys, feet, and normal nerves. Some statistics about diabetes in the US. 34.2 million people, or 15.5% of the US population, have diabetes. An estimated 26.8 million people had diagnosed diabetes.
I've had type 2 diabetes now for 15 years, diagnosed in 2005, and the problem with diabetes is it's a progressive disease, so the effects of it are felt over many years. It's not like other diseases where you start noticing things straight away. So I've been managing it with tablets, exercise and diet, because the next step is to go onto insulin, which I'm trying to avoid. How it affects me, you do feel tired a lot of the time, and if you don't eat healthily on a regular basis, you can start feeling cranky, which is one side effect. You can also start feeling confused, you start forgetting things. Another effect, long-term effect, is you start feeling pain in your feet, your legs and your fingertips, what they call your peripheral organs, because the blood or the isn't getting to these places, so your circulation is also affected. And diabetes, it's a major concern here, especially in the West, because a lot of children now are getting type 2 diabetes because of bad lifestyle, laziness, not enough exercise, or just eating unhealthily. So education is a key thing in trying to prevent the next generation being affected by this. Another thing with diabetes is that you end up having a lot of checks. So you have to go to the doctors every year. You need to have blood tests every year. You need to have your eyes checked every year. You need to have your feet checked every year. And the reason they check your feet is they want to make sure you can still feel things. So they do a sensitivity test to make sure you can still feel things on your feet, because if you can't, that means you have nerve damage, and the long-term effect of that is amputation of the legs. So it's very, very important that you attend these checks and these sessions with the medical teams. I hope that's given you enough information to go on, and I wish you well and good luck with your project. Thanks, bye.
Now, how do we spread awareness? November is the month of diabetes awareness, and this year we want to empower you with some quite sobering statistics and really encourage you to talk to your friends and family about diabetes and how diabetes is affecting you or your family. Did you know that over 1 million people in UAE have diabetes? That's over 17% of the population. That means that everybody has a neighbor or a family member or a grandparent or someone in their friend circle that they know who is dealing with diabetes. And we as a support group want to encourage you to seek those people out, talk to them about their diagnosis, or talk to them about how it's affecting them and their family, and really provide them with some encouragement. The real scary thing is that there are more than 300,000 people in the UAE who have diabetes and aren't diagnosed. So they're walking around not feeling great, but also not realizing what they're struggling with. And as we talk about it all the time, diabetes is manageable. Yes, it's hard. Yes, it takes a lot of work. Yes, it may require the help of an endocrinologist or your general practitioner to prescribe some medications, perhaps even insulin. It requires checking your blood sugar. It may require using some new technology like an insulin pump or a CGM, but it is manageable. And you and your family will feel so much better. So let's go out there this month and really make an effort to encourage and educate people around us about diabetes and how important of a problem it is in today's world. After looking into this matter in depth, the ITH department has surveyed the students of AIS, from which 83% knows someone who has diabetes, and 80% of them thinks it's a very serious condition. So let's stand up and fight against diabetes. Check out these diabetes awareness posters made by our Creative Bio Club members, and make sure to give them a like on our Instagram page. I hope this documentary by the ITH sector of the Bio Club was informative. Thank you for sparing your time with us. Stay safe and spread the word.